Hello and welcome everyone. I am Dr. Jennifer Hall Landy from the University of Minnesota campus. I'm sitting here at the Masonic Institute on the Developing Brain, and I wanted to welcome all of you to our final webinar today. It is a beautiful fall day. I hope everyone is enjoying our long, beautiful, and warm fall. So welcome again. We are so happy you are here. So I'm going to start today, since this is the final in our series, talking about our goals. I know we skipped the month of September because of Labor Day. So just to remind everyone, our Act Early and Follow Along webinar has several shared goals. One is we want to support early developmental monitoring. We actively promote routine developmental screening for children birth through 5. We work very hard for early identification of developmental delays. We provide information on early signs of autism and other developmental delays. And one of our biggest goals is to connect you to resources. And you will see today that is the focus of everything we're doing today. It's going to be a very resource-rich day. Couple notes about our sponsors. I lead the Minnesota Act Early project. We're committed to helping families monitor development and identifying children early. We also are sponsored by Minnesota Department of Health and the Follow Along program, Minnesota Autism Resource Portal, and our Minnesota Autism Developmental Disabilities Monitoring Network. So thank you to all of our sponsors, and we're excited to get started today. Again, for those of you who've been with us since March, yes, we started this way back in March, first Monday of the month. We've had a webinar series every month except for September. We started with developmental monitoring and autism, and here we are in October. And the title of our final webinar series is From Learning to Action, Key Takeaways and Resource Highlights. So this is our final webinar series of today, and we're really going to focus on resources. So thank you again to those of you who've been with us every month, and to those of you that are new today. All of you are welcome, and we're so happy you're here. So I am going to get started with some of the resources for projects that I lead to share. So as I shared, I lead the Minnesota Act Early project, but it's part of a broader national project with the Centers for Disease Control and Prevention. We're a public health project. Sometimes you'll hear me say Learn the Signs, Act Early, but I often shorthand it for Act Early. And it's a project that really is focused on getting resources in the hands of families, professionals, anyone who works with children birth through 5 or has a child birth through 5 in their life. How can we make it easy for example, caregivers and families to monitor their child's development and to really act early if they have concerns? So here's just a cross section of our most popular materials, but Amanda is going to help me. We're going to go to the Act Early website, and Krista, my colleague, is going to put in the chat. We're going to see how this goes. We're going to be doing a lot of flipping back and forth, but here is the Act Early website. Learn the Signs Act Early. It's a national website. You'll start there, and then you're going to scroll down to free materials. Looks like we're already in free materials, and that is just fine. But I want to make sure everyone knows there are a wealth of free materials that you can order from the Centers for Disease Control and Prevention. We're going to talk a bit more about the Milestone Tracker app a little later, but I want to show you we have a variety of checklists all the way from 2 months all the way up to 5 years. Amanda, can you check on our 2-year-old checklist just so we can show everyone at home? So here is a checklist. Oops, we're getting our survey. We'll ask you, you can always skip the survey. There's all kinds of checklists. We can go back and scroll down that parents can look at. I'm going to encourage you to take a look at any ages. We have them in a variety of language, but they're tips that parents or childcare providers or healthcare providers can look at and see what a child should be doing at that age. We're going to keep going. We're giving you sort of a slow walk through some of our materials. There's books. Those are some of our most popular materials. So we have Baby's Busy Day for 1-year-olds, Where's Bear for 2-year-olds, Amazing Me that talks about development in 3-year-olds. I'm not going to download the PDFs, but you can look at the PDFs. If you go to this site, you can also order these books. They're storybooks. They're not textbooks. They're storybooks that walks a family through development via a story, but also connects it to developmental milestones you should be seeing in a 1-year-old, 2-year-old, and 3-year-old. Some of our most popular materials, they're great for free giveaways at literacy nights, where healthcare providers give them away at well child visits. I really encourage you to take a look. And then just Amanda's going to continue scrolling down. We have all kinds of materials in a variety of language that you can order or print and use with families. All of these are to promote healthy developmental monitoring and helping act early if there are concerns. One quick one, the growth chart Amanda's going to click on, and then I'm going to have us click off this page. This is a beautiful one for public health. These are growth charts you can print out or order. And they're wonderful. They talk about the developmental milestone also intersected with typical immunizations. They're big, and you can mark how tall a child is. So people like putting them on doors in their homes. Families love these. I encourage you to order these, take a look. Just a wealth of free, yes, free materials, no charge. We're not selling anything. We just want to put materials in the hands of professionals and families to help monitor development. Now, Amanda's going to take us for a little, she's going to switch to her phone, and we're going to walk you through the Milestone Tracker app. This is a free app on the phone. We hear from parents, although I will say there still is a lot of popular, our books are in paper and they're very popular, but a lot of people want to use their phones, a lot of parents, right? So we have the CDC's Milestone Tracker app. You can Google it. Krista's going to put it in the chat, linking how this can be downloaded. We have Elijah here, our 2-year-old. This is the interface you'll see. We have milestone checklists. Amanda, if you can, some of the options we're going to walk you through entering some of the developmental milestones, but it also has tips and activities. You see that down there, helping prepare you before a well child visit, some of the questions you should be asking corresponding to age, helpful resources, activities. It is just a wealth of materials for you to look at on your phone. It has videos in terms of what's certain developmental milestones look like. It's just a wonderful resource. We're going to just quickly walk you through some of the functions. Amanda, why don't we go to entering some of the developmental milestones now? So pretend you're a parent of Elijah. We've already entered some of these because we didn't want it to take too long, but we're walking through. So you see up at the top, we have the social, language, cognitive, movement milestones that we see in early childhood. Parents answer these before, this is before the 2-year-old well child visit. We've clicked, Amanda, why don't you put some, for example, not yet here she already has. And then we're going to enter all of those, but you can sort of see, not sure, we're moving across. I'm not sure how well you're able to see this. And then let's enter that, Amanda. So we've entered all of these developmental milestones for Elijah. We can enter notes about things we want to talk about. It will give a summary of what Elijah's doing, what Elijah should be doing, and questions that you should ask your healthcare provider. So it's really a wonderful tool. If you're doing home visiting, you can walk through with parents how to complete this, and it gives them actual language and questions to talk with their healthcare provider about for milestones that are being met and those that aren't. So it is just, we're only giving you a small percentage of the resources that are there. It also looks at where there's delays and offers specialized activities and resources around that. You can email it. You can email it to your doctor. They're just a wealth. Here's it auto generates an email for your physician. So it's great. A well visit snapshot. We're not going to go through all of it in the interest of time, but I really encourage you to download a test child. Elijah is a test child today. Run through it, and either for your own children or if your professional works for families, it's a wonderful tool and a wonderful resource. And with that, I'm going to go back to my PowerPoint to share one more resource. Finally, another project that I lead is the Minnesota Autism Developmental Disabilities Monitoring Network. It's a mouthful. I shorthand it to Adam, but what you need to know, and we're going to go to that website, it is another sort of wealth of information about autism rates in Minnesota. Amanda, if you can scroll down, please, you can take a look at what our rates are currently in Minnesota communities. We know that when we look at our 8-year-olds, we're seeing about 1 in 34, 3% of the population we looked at. And then we also track in 4-year-olds, but we have a lot more information about Minnesota rates and trends, including age of identification. what it looks like across male to females, what it looks like across racial and ethnic groups, and how are we moving the needle on that earlier age of identification. We know with autism, as well as any other developmental delay, the earlier we get to children and families with services and supports, the better their life outcomes. So there today, I've shared 3 resources, some of which are specialized to Minnesota, that will really help support your practice and supporting your child in the early years. And with that, I am going to turn it over to my colleague and friend, Michelle Quickstead from the Minnesota Department of Health Follow Along program, who's going to walk you through some wonderful resources that she works with. Thank you, Amanda. You did a beautiful job going across multiple resources. So good job. And with that, Michelle, I'm going to turn it over to you. Thank you.
Thanks, Jen. Hi, everyone. My name is Michelle Quickstead, and my role at the Department of Health is to coordinate the statewide planning efforts in early identification and intervention. I support efforts to ensure developmental and social emotional needs in children are identified as early as possible. So, as Jen mentioned, that's really important for us to connect families to supports and services within our systems. If you didn't already know this, I wanted to share with you that we have 6 developmental screening programs in the state of Minnesota. As you can see here, child and teen checkups, otherwise known as well baby visits, early childhood screening, the follow along program, Head Start and Early Head Start, family home visiting, and child welfare or child protection. There is a representative of each one of these programs that participate in a task force. And the Developmental Screening Task Force prioritizes statewide coordination of screening efforts, establishes criteria for developmental and social emotional screening instrument selection, and provide a psychometric review and list of recommended or approved screening instruments for Minnesota's public screening programs. And so as we go through what I wanted to just mention, thank you for all of you who have filled out surveys and have given us feedback. We really wanted to provide for you a summative of all of these great resources that we had talked about in our previous sessions. And those of you who maybe haven't been able to join us, they're listed on the website, and Krista will be making sure that you get that. But as we go through our resources today, we actually wanted to take you to those sites, more of an experiential learning experience, so to speak. So Amanda is going to take you to the Follow Along program website. That's the program that I lead that talks about and supports families with early childhood development. So it's a really simplified web page for you, designed by people before me to really talk about how is a child developing, how are they staying on track, and how can caregivers and families support their child's development. So I want to highlight this as one of the only early childhood screening programs in the state that connects families to supports and services that does not require a face-to-face meeting or any eligibility. So when we think about the 6 screening programs, they each fill a need, and not all of them are built the same. This program in particular is designed to be free for all families without any a need to provide immigration status, citizenship, or financial status, and it's led through the Department of Health. It's currently implemented by local public health programs in 84 of 87 counties. We recently added a few more counties to our list. So as you look at this webpage, we haven't even had a chance to update the new counties. So Amanda's going to go ahead and scroll down. As you're sharing this with family members or looking at it yourself, again, it's designed to be really simple and fast, easy understanding for you to look at what the program is and how to enroll families. And so as Amanda keeps going down, we really try to highlight how does it work. We send out questionnaires, and we also send out developmental resources and activities as a child grows, and we have a chance to follow them along in their development. How do you sign up, you might ask? Or how do you sign a family or a child up? Amanda's going to click on the Enroll Online link, and it's very simple and intuitive. You can, at the top of the page here, choose English or Spanish. We're working on adding some more languages, but right now we have the 2 to choose from, and it's very intuitive. You scroll down the page and fill out the form. And again, if you're filling it out on behalf of a family member, we really like to know who we can tell the family that made the referral or the contact. If you look at this referral form, there are kind of red stars or red asterisks next to areas that you need to make sure that you fill out. So the guardian's name, primary spoken language, we want to make sure that we're supporting that family in that initial contact as best as possible. Insurance is just to really help us if there's a question or concern that we want to help support the family and follow up. That's helpful information, not to be intrusive, more to make sure that we're getting resources directed to the family and meeting their needs. And so as Amanda goes back to that previous page, I'd like to highlight another partner of ours. Oftentimes, when we think about screening or connecting a family to resources, we think about what's a delay or a disability. And so oftentimes we're asked, do we need to do a screening before we get referred? Absolutely not. If you have a concern about a child's development right now, on our website, Amanda's going to click the Help Me Grow Early Intervention online portal. And that will take us to the Help Me Grow website that can give you lots of information, not only about enrolling a child into the referral system, but also to give you more information about developmental resources as well. So Minnesota's Help Me Grow is the referral system in Minnesota and 11 tribal nations who share land with us to provide families a connection to early supports and services for infants, toddlers, and young children when you have worries about their growing and their development. Help Me Grow has many resources about the development of young children for parents and professionals. So Amanda's going to go to the top here, not that one, Amanda, but the one in the middle that says helpful resources. There you go. Yep. So if you go ahead and scroll down resources for professionals, it's about midway down. There you go. This will go ahead and scroll down and it will talk a little bit about conditions. It has videos, it has quizzes, just lots of different materials. And then, of course, Jen showed us some materials that Learn the Signs Act Early helps. Help Me Grow also has some additional resources. If you go back to the previous page, I also want to point out the Refer a Child. So Amanda, that blue link that you were starting to click on there, yes, please. And then go ahead and click on the professional form. Much like the follow along program screening form, if you have concerns about a child's development, you can refer them if you're a professional, if you're a parent, or if you're a family friend. I want to note at the top of this referral page, Amanda, if you can highlight the yes, no. This area says I have consent from a parent or a guardian to release information about this child. And when you click on that yes, it gives you some different options and gives you the opportunity to add a little bit more information. So again, if you have concerns about a child's development and you don't want to wait to find out screening results, you can do a referral to have an evaluation done by the local school district. So again, Help Me Grow is an online portal that connects families to their local school district based on their address. So this form, when you fill it out, it will take you to the local school district, and that's how the family will get connected for those supports and services. If you go back one more spot, Amanda, at the bottom of this web page, it will take us to our friendly resource, Help Me Connect. And as Amanda clicks on that, I want to talk a little bit about our resource, Help Me Connect. It's a wonderful online resource that helps expectant families, families with young children, professionals who want to find services in their local communities that support healthy prenatal and early development. It gives you information about mental health supports, basic needs, and family safety and well-being. Now, my good friend Sean Holmes leads this activity with Victoria Lee, and they are continuously updating resources on here. And so please, at the bottom of the page, it has information about how to connect. If you are in your community and you don't see a resource on here, you want to make sure you get added, you can go ahead and click that Help Me Connect at statemn.us, and it will take you to connecting with Sean and Victoria to update that. If you go to the top of the page, Amanda, I want to show you one more thing before we leave this site. There is an about page. I don't see it on the screen that's displayed here, Amanda, but do you see? There it is. There it is. Awesome. For those of us who are supporting families, I want to point this out to you because this has available outreach materials. So as Amanda scrolls down, it will talk to you a little bit about what's included in those outreach materials, how funding is done for the Help Me Connect website. But the Help Me Connect flyer, a rat card, a poster, they're also done in English, Spanish, Somali, Hmong, and Karen. And so when you think about for your clinic or for your agency or for your school district or for your childcare center, you want to have some of these resources available, you can order them right from the website and we'll get them to you. That's for the follow along program, Help Me Grow, and Help Me Connect. Thank you so much, Amanda, and I appreciate you sticking with us and learning a little bit more about these resources today. I'd like to hand it over to my friend and colleague, Nicole.
Hi everyone, I'm Nicole Burning. I work as the Autism Clinical Lead at the Department of Human Services. And I'm going to just highlight a few of the key aspects of the Autism Resource Portal website and let you know how you can help make more person-centered referrals, help to kind of troubleshoot some of those common barriers that we run into when we're looking for resources. So go to the next slide. So this is just the main page of the Autism Resource Portal website. Really, the intention of the website is to be kind of a one-stop shop and a complete resource guide, really for anyone that's looking for any type of resource. And it does span the entire lifespan. It's not just for children. This does go into adulthood as well. It really was something that was created with a lot of advocacy from parents, autistic adults, community members, that really said that we need, one centralized location for all of the resources, and to know that, the resources here are things that you can trust, because when we go around Googling and searching for information, it can be hard to decipher, what's something that we can trust and what's something that maybe is not a path that we want to go down. So you'll see resources across Department of Human Services, education, health, even into our employment, transition age resources into adulthood, and then from also our community partners as well. So a lot of advocacy supports, parent support groups, things like that. What's nice about the website is that you can also be submitting resources. So if there's something on here that we're not aware of, that we don't have on here, you can use that contact us little mailbox icon up at the top right-hand corner to submit that resource as well. And we can go on to the next slide. So we'll kind of go through a live depiction of the website here in a few slides, but I just wanted to point out the Pathway to Services and Supports link up at the top right-hand corner. So in our past ECHO webinars, we had gone through some of these Pathway resources, but really the Pathway series is meant to have a resource for, kind of no matter where you are in your journey. There's everything from following those early developmental milestones all the way up through that transition age. So if you're looking for any of these resources, if you would like to order copies of them, we have them in multiple languages. You can just go to that icon up at the top right-hand corner and find these different resources, and then you can also click on the tab at the top and order them, and you can receive paper copies in the mail. We can go into the next slide. So this is just the main icons that are featured here on the main page, and really just meant to be, as it says there, I'm looking for help with, and maybe you're just getting started, so you're not even really maybe sure what you're looking for, but maybe you just received a diagnosis, the child's just received a diagnosis, or you're working with a family that's just received a diagnosis, and just want to know, what are my next steps? Where do I get started? So you could click on that tab. The next one, these are things that we're frequently getting questions on. People are often coming to the website for more information. So different supports in school, different resources on healthcare coverage, looking for those community supports, like I mentioned, those advocacy organizations, support groups, oftentimes things like, where's like a community recreation option, or where are there sensory friendly events in the community. That would be something that you could find under those community supports. Then we also have a tab just for the transition age resources, and then a link for identifying and understanding more about autism. So that would be a good place if you're looking for, information on, where do I go for the diagnosis? We get a lot of questions too about those differences between the educational determination and the medical diagnosis. So you could go to that tab for that more information. And again, there'll be sections for children and then also for adults as well. But this is just a way to really kind of quickly navigate to those important topics that you might be looking for. And again, some of these are just some of the more frequently asked questions, but of course, the website has a lot of other information and resources as well. You can also search, there's a tab specific to the quick links, and that will take you to a lot of our community partners. A lot of these resources that you just saw my colleagues go through are found there, but other important links to like the Disability Hub of Minnesota, our Minnesota Healthcare Program directories are found under there, all of the state agency websites. So just another place to kind of quickly navigate to those. And then, as I mentioned, if you're not finding what you're looking for, or you're just overwhelmed by the amount of information, you can certainly always use that Contact Us tab, and that will get sent directly to our team. If it's not something that we can answer, we certainly work to try and get you connected to the right area and the right group that will be able to help answer your question. So we can go on to the next. So this is just an overview of all of those main tabs. So under About Autism, again, you'll just find those very basic information around signs and symptoms, the screening and identification resources. We also go into things around co-occurring conditions. We know individuals often will either have a mental health condition, medical conditions that go along with autism, so you'll find information on that there. We also include some information on the data and the research around autism. We also include all of our trainings and events under one specific tab, and then any videos, podcasts, things like that that have been done or are related to autism you can find under there. Under that basic needs, you'll find those things like the healthcare coverage information, connecting to childcare, food and nutrition, housing, transportation, any economic assistance. Under the intervention and services or the program and services, you'll find things around education, healthcare, and wellness, our services tab, and then things on technology, equipment, transition planning. And then that last tab there, the supports, again, those community recreation support groups, advocacy organizations, also things around our legal support. So you'll find like the ombudsman information there, the Disability Law Center, those types of things. We also have some culturally specific resources. And then we do have a whole section on around safety, so resources to create a safety plan as a family. Also, resources around wandering, elopement, planning for that, fire safety, all those different types of things in that tab. And then just some strategies and supports. And we really try to share that information as some, just some quick things that, maybe you're on a waiting list for services or you're not ready to get started with services quite yet, but you're just looking for, some support right away. We have some information about, maybe getting a routine in place, setting up a visual schedule, just some things to really kind of help get started with some effective strategies of working with the individual. So that's just a very high level overview of what's included on the Autism Resource Portal. You can go to the next. And then I mentioned the training and events tab, so you'll find things on-demand training. So if you're looking for, continuing education credits, just learning more about autism, those effective strategies, anything like that, there's certainly plenty of on-demand trainings that you can take. There's also information on our events calendar for live training. So, like this event now, but any type of webinar that will be featured in the future. Again, this is a good place that if you're having an event coming up and you would like to share that out with everyone, this is a good place to be able to add that. You can click on our add an event tab and just include the information and we'll get that added to the website. There's also things on implementing person-centered practices into your work, neurodiversities and positive behavior support trainings, all of those different types of things. So also, if you have maybe a resource fair coming up in the community or a conference or something you would like the autism group to come out and present at, you can also use the request an event tab as well and just let us know about that, and we'll try our best to make those accommodations and come out and present more information on autism as well. So we can go on to the next. And then I just want to feature some of the person-centered planning tools because these can be really helpful, especially as you're trying to kind of sort through all of this information and decide, what resources, what referrals to make for individuals. We're sticking with our child that we used in the example earlier, our Elijah. He's a little bit older now and moving into some school supports here at age 7. But this is just the one-page profile, and you can find this on the Autism Resource Portal under our programs and services in the services tab, which we'll show you where to find that here in the next few minutes. But just to be able to kind of go through here and describe, really who is Elijah, what are things that are important to him, what is he really good at, what are the best ways of supporting him. These can be really effective tools to be able to share. I know right now it's a really popular tool to be sharing with teachers, paraprofessionals, sharing out in the school setting. Just a nice quick way for those individuals to get to know the child and get that little bit more information, just so that they have that background and some of that insight into being effective and working with that individual. So just a good way to summarize all that information into one. But you can find this template so that you can fill this out with anyone that you're working with. We can go on to the next. So just another person-centered planning tool. This is called the Integrated Support Star. So again, using our example with Elijah here, and this is thinking about resources for his whole family. But this is a nice way to kind of summarize the resources that they might already have, and then start thinking about, where are some of the gaps, where are the things that we might need to be looking for. So those eligibility specific, those are maybe our more structured, more formalized supports that he might be accessing through, waiver medical assistance programs, but then thinking about, community-based resources. And so as you're looking through some of those community supports, you could be filling in that section and finding some additional maybe events, community recreation options that he could be attending to help, better meet his needs, increase socialization out in the community, that type of thing. Same with, the technology, looking under the technology and equipment tab for some more information there. Other ways, just connecting with other supports in the child's life. Just a nice way to, again, summarize the things that the child is currently receiving. And then also a quick visual way of identifying, okay, we need a little bit more support in this area. Where can we, utilize the resources on the website to help fill in those gaps? So just wanted to share a couple of those examples, and then I think we're going to switch over to the website. Great. So this is just the main pages I had shared with you. We could click on maybe that identifying and understanding autism, yep, right there. Perfect. So again, these are just some of our frequently asked questions. You'll see things about, just what is autism? How do I schedule an evaluation for my child? How do I schedule an evaluation for myself? What are those next steps following the diagnosis? So again, it's a nice way that if you're not even really sure what exactly you're looking for, that you can come here and find, those resources, those next steps, and available information, and hopefully in a way that is a little bit more digestible and less overwhelming to be able to go through. So we can go back to the main tab. Yeah, so from that main page there, we can click on the pathway to services and supports. So as I mentioned here, all of those pathway resources, so starting with that first steps, that one goes through those developmental milestones. You'll see the follow along, help me grow, all of those great programs are found there when you're first identifying any type of concern. What's nice about that one, it doesn't even mention autism on it, so it really could be used for any child, any family early on, and really shared for a variety of any developmental delay or concern. So, and then getting into the overview of the medical identification resource. So that again, talking about those similarities and differences between those two, educational versus the medical diagnosis, why it's really important and key to be able to get both for the child. If we scroll down a little bit, then we get into the next steps resource. This is great for the family after that first year following the diagnosis. So really going through what are, just the key next steps that I need to take. It has information about healthcare coverage, getting connected to a MinChoices assessment at the county. Also, it has places like the Family Voices in Minnesota, Autism Society of Minnesota. So getting connected to those family supports right away, building up that support network, and some of those trainings too, those online trainings that the family can just learn more about autism, learn about their child's condition. And what's nice on the back of that resource, there is information to be able to fill out, who you called, when your appointment is, when maybe you need to follow up on that appointment, those types of things. So just a nice way to kind of keep organized and keep that information and get started. And then that pathway resource, it has a really high level overview of all the supports across the lifespan and across the different service systems. So that's a great one to be able to share out. The next stage is kind of our transition to long-term services and support. So we think, anywhere from 14 on up is a helpful resource here. We also have this resource where it's not autism specific as well. And you can find that on the portal. So it's great to share for a variety of different conditions. And then we do that final resource there is just the guidebook for parents and caregivers. So that has all of these resources, but in a little bit more detail, a little bit more information about all of that if they really want to kind of dig in and find a little bit more. So kind of going beyond the basics. So we can go back to the main tab. So as I mentioned too, that autism resource request form, you'll actually see it there on the main page. You can request all of those resources, have them sent out to you directly. We also have like the early intensive developmental and behavioral intervention, or the EIDBI brochure is found there as well, and that's translated into a variety of languages. Or you can also click on that request form for additional translations, and that will bring you to those information. We want to scroll down just a little bit and you'll see all those upcoming events. So like you see the event that you're watching right now is listed there. But yeah, you'll find, upcoming information on events, and you can click on those and it'll have registration details. If it's an in-person event, it'll have the location information, that type of thing. We also have a section on latest news updates. And then at the very bottom there's a place that you can actually join the Autism e-list. So if you're interested in more information or updates, you can just add your email in there and you'll be connected and get information on that.
Nicole,
Yeah.
this is Jen. I don't want to throw off your flow.
No, you're fine.
Love how you update, daily these events. And so this website, it is updated, I think daily, right? Nicole, I mean, I
I would say
it's very recent.
very frequently. Yeah, we're always adding more.
Yeah, if you take a look at the events and do see all, Amanda, so you see just a variety. And I just think this is impressive. Sorry, Nicole, I'm just bragging about
No, you're fine.
And sometimes I ask Nicole a question and she will say to me, well, it's on the Autism Resource Portal, Jed. Why don't you take a look there? It's just a one-stop shop. And I didn't want to interrupt, but I really think credit is due here of how updated you keep this and what a wonderful resource this is across the lifespan for families and children and autistic adults. And really, we can't do it justice unless we had, 5 hours, but I encourage everyone to visit. And Nicole, I'll turn it back to you, but I just wanted people to see just how this is updated in real time and just the wealth of resources, even events.
Yeah, we try to really make it a really helpful resource and, really listen to input from the community. So again, if there's something that, we're missing or that we think would be helpful, definitely reach out and share that resource with us, especially if there's things that are just, region specific, obviously, we don't know about all of the things that might be happening right in your community. So sharing that so we can get that great information out to everyone in the community. But when we click on the programs and services tab.
Nicole, as you're doing that, can you show how people can find the languages?
To the pathway documents, you mean?
Yeah, are these pages translated in other languages? Can they flip back and forth?
The website itself is not translated,
Okay.
but the pathway resources are. Yep. Yep, so all of those are listed. So you'll see usually the top 7 languages in Minnesota are listed out for the resources. Yep. And then that you'll see use this request form for additional translations is right up at the top there. Yep. If you click on that, then they'll bring you to a page to request those specific, so it'll list out all the different resources. You can just type in the number of how many copies you want, and again, those will get sent out to you.
So Nicole, not to keep adding, but this is just such an great resource. If we click back to Pathways, I've used this many times. So if we take a look at first steps, we have English. Amanda, are you able to click on that PDF? Will it throw things off too much? So there we have this. This is a wonderful tool to give to parents, sort of first steps, developmental milestones, another resource for that. We have other ones that show sort of pathways when you're early referral, but then another language. Amanda, can you just click on, for example, Spanish or Russian? So when working with families, then you can provide this as a resource to them. So there's just so many. I mean, you look at it, but then clicking on the links, there's just a lot of wonderful tools to use with families in a variety of languages. Nicole, back to you. Sorry, we're just so excited.
No, that's okay.
There's
That's
just so
great.
much here.
Yeah, so the programs and services under the services tab. Yes, perfect. Thank you. So again, this one is where you'll be able to find information like that early intervention, that very first drop down little toggle there is where you'll find information about EIDBI specifically. It starts off with just some basic background information on the benefit. It does have that training, EIDBI 101 for families. So that's always a great resource to get started, giving families more information. But then, just wanted to point out that to make a referral to EIDBI services, there is that EIDBI referral form. And you can certainly, click on that and just see. So this will just have a language block. So if the family does need the information translated at all, it'll give them that option. Or they can connect with an interpreter to have the resource read to them. And then it'll just start kind of going through if you want to maybe just click on the next tab. We won't go through a lot of it, but it's very similar to the Help Me Grow referral. So kind of get started again, asking you, which role fits you if you're making a referral on behalf of the parent or legal guardian, or if you are the person directly making that referral for the child. So you can input the information. This just gives us a little bit of background information on the child, their age, if they're on medical assistance already, and then the location. And we do also ask if you have a preference between like center-based or home-based services. And then we'll send out information on some of the providers. So this can just be a helpful way to try and narrow down the list of available providers. And we do try to do our best to get families connected. Not saying that they might, not still run into waiting lists or, especially in rural parts of the state, there might not be a lot of availability, but it's just a helpful tool to try and do our best to try and get families connected to an EIDBI provider. So I wanted to point that out. We can go back to the services tab there. And yeah, we can close that toggle up. And then I just wanted to point out there is that toggle on the MnChoices assessment and support plan. I know that's another important key step for families, if they're looking to get connected to that case management. Any of our new, we have the new CFSS, the Community First Services and Supports. That's kind of our combination now of PCA and our consumer support grant. I know that's going to be very helpful because that allows the parent to be their child's caregiver and be reimbursed for those services. So if they're interested in any of those, that MnChoice assessment is that first step. So they can learn more about that assessment, how to get connected to that with their county. They also have a lot of great videos now that walk through the process, and they're translated into a variety of different languages. You can also order print versions of those materials as well. And then maybe just the last toggle we could click on is the how to create more person-centered services. Perfect, thank you. And that's just where if you want to, scroll down a little bit, you'll see that link to that one-page profile, that trajectory that I shared, or not the trajectory, the integrated support star that I shared. So all of those are great, really, simple, easy tools to be able to work with a family. And again, really kind of make those person-centered referrals and find helpful resources for the family. So just wanted to share where you can find all of those. But I think, yeah, that's a good high level overview of the website.
Nicole, that is great. One other, it looks like we have a question. I'm trying to skim the question around medical and around the clinical medical versus educational. I know you have a lot of resources on this website,
Hmm.
including the overview sheet, but also I believe do you have some videos as well? We have the
I mean,
overview sheet.
yeah, we do have the overview sheet. I see the question specifically if the child had a medical diagnosis of autism, but the school did not qualify for the child under autism, what would the next steps for the family be? So they could certainly still, apply for those that eligibility through the MinChoices assessment. With that medical diagnosis of autism, that likely would help him qualify for, or I'm not sure, just as child, that would have qualified the child for medical assistance. Um, Most likely, and then they could also get like a disability determination, and that might be able to allow them like any waiver supports or additional supports through the county. So even if the school's not determining an educational need, they certainly can still explore eligibility through that medical diagnosis piece. So yep, reaching out, getting that MinChoices assessment scheduled, potentially EIDBI services if that's something the family might be interested in. But yeah, the overview again is under the pathway to service and supports tab. Yep. So yeah, just that second resource there is that overview of the
Can you click on
educational
English?
determination.
Yeah.
Yeah, so that'll just go through the what's the difference between the two, why they're both helpful, but if certainly if the child only has one and not the other, kind of focus on that section and what the child might be able to access through that determination. So
It looks like there are lots of great discussion topics in around response to referral. And so we have a combination of resources that we're providing today, one of which is materials and follow-up steps, and another are direct referrals to intervention programs. And I just want to speak to questions and concerns that I've been hearing, not only in today's session, but also just throughout with uh, programs not getting back to families, or maybe a referral getting dropped or lost, or and so there's been a little bit of a chat here in the Q&A, and I just wanted to say that all of the programs that support interventions for children and families really want to have a timely response. Sometimes there's a barrier that gets in the way, and I'll just speak to the follow along program. In the last, probably over the summer, I had a handful of families reach out to our online, just like mailbox, saying, I contacted this person, they didn't get back to me. And when I followed up, there were just a variety of reasons why that happened. Maybe the web address changed or the email address changed from like a county to a .gov, and it wasn't caught that it wasn't changed on the website. Sometimes phone numbers change or staffing change. And so if there's a person that's connected to that referral form and they're out on a medical leave or something happens with the staffing, it's hard to believe, right, that can happen, but it does. And so I really am encouraging all of you to be persistent, that if you know that a family needs a referral or there's been a contact that's been made and no one's reaching out to that family or you, be persistent and find that phone number on the webpage or that mailbox on the webpage and let them know that you're not getting a response. John or Nicole or anyone else on the call, I know we have other partners in this call. What else would you add to that when people aren't getting a response to a referral?
I like your suggestion of persistence. We also, sometimes I have heard that to your point about phone numbers that change, sometimes people are expecting a call back from a certain phone number, but it's often a school district after they've made a Help Me Grow referral, and then they're surprised, why is a school district calling me? My child's only 2 years old. So one, be persistent. I completely agree with that. Two, well, they may leave a message, so listen to the voicemail messages. I'm guilty of that one. I guess I'm talking to myself there. But one, typically they're following up in a timely way, but if something is off, please reach out and just, I think, persistence. Nicole, do you have anything to share about yours? I have something from the clinical world I want to share that's a little bit of a divergence, but our waiting lists are long in terms of autism clinical diagnoses. One tip I always give families that's a little bit different than what you're asking is always add your name to the waiting list. Don't be discouraged by it and then just hang up. But sometimes those move more quickly than you think. But not putting your name on it will always guarantee that you won't be moved up. And I know that sounds obvious, but really that's another sort of persistence piece. Nicole?
Yeah, I will say, under the About Autism tab and under the, screening and identification, we do have a whole toggle on the, resources while you wait, and we reviewed that information. But, that's a good first place to start as you're going through that process. But like I said, that contact us tab, certainly reach out to us directly with your question, or, you know, you may have already tried all the resources in your area, but there might be somebody, especially, sometimes there's a home-based provider that, they aren't listed as being in the area, but they could actually serve the area, because they could send providers out there, or we could help get connected via telehealth, or something like that. So certainly doesn't hurt to just get connected with the team, and we can try to troubleshoot some of those barriers that you're running into. But yeah, just a nice way that you can for sure be connected with someone, and feel like you're talking with someone that is familiar with the resources and the information. So
Nicole, I think that's so great to kind of add. I see a heartfelt request in the Q&A about thinking about family members' literacy levels when we think about translated documents and navigating our websites, that this can be really tricky for professionals who live and work and speak this language, but it's certainly tricky for families, especially English is their second language. And so, Nicole, what I hear you saying is if someone gets stuck and navigation is tricky for lots of different reasons, there is contact information. And so as providers and as support staff within the community, how do we connect family members who are seeking these resources, get connected to a live person? And so, Nicole, I think that's what I heard you just say. Find
yes,
support.
Yep, I think that's a great way. Otherwise, you also find a variety of any of those videos, even that online navigation tool that you can click on at the top, or like I mentioned, the EIDBI 101 training. There's also the pathway to EIDBI services. All of those are basically, they just read through the information that is on a lot of the written resources. So those can also be very helpful for any linguistic barriers. So just kind of and those are translated into Hmong, Somali, and Spanish um, as well. And then there are transcripts for the EIDBI 101 in other languages as well. But and we've also had a lot of providers that will, or even support groups, advocacy organizations that will present them, have an interpreter come in and present all of the information in another language for families to be able to hear the information and get connected as well. So yeah, we're hoping the resources can be as helpful as possible. But
All right. Well, thank you, everyone. I hope we provided some resources and tools today. Amanda, I'm just going to take us to the final thoughts here. So if everyone can think about, I know when I was practicing on early childhood teams, I was I just want resources. I just want tools. When I would go to a speaker, I want something that will help my practice. So I hope today we provided some of that for you. If you can just some food for thought or final thoughts, if there's one tool or resource on the Autism Resource Portal that you plan to share with families that you learned about today, feel free to put it in the Q&A. We don't have the chat widely open today because we have such a big group, but feel free to put it in the Q&A, or one thing you learned today that you hadn't heard about before. I always feel if I walk away with one new resource or tool, it was worth my time. And then anything that you need clarification on or something new you learned, feel free to put it in the Q&A. We'll take a look at those at the end, and we'll try our best to answer those for you. But yeah, please let us know if there was something new you learned today. Next slide, please. So again, we're at the end. Couple things. I want to show you one more resource today. we compiled across all of these webinars, we compiled resources from all of you. Our goal, we aren't the only people on here with knowledge of resources. Many of you, especially specific to your communities, knew about things and told us about things after the webinars that were so helpful. And we wanted to make sure we shared that knowledge with all of you. So we created, or Amanda, who you don't see but has helped with a lot of this, created a web publication. You can access it. Krista's going to put it in. Amanda, could you go back to overview, please? A couple things. If today was your first day, welcome. Or if you've been here before, welcome. But if you want to look at our previous sessions, look under session topics after you click on this. And we have recorded all of our webinars so they can live on forever. Past this being done, I did the intro on developmental monitoring and autism. You can just click on that really quickly. Amanda, we're not going to watch the whole thing. We don't have time, but if you scroll down, you can rewatch the recordings. All of these: autism and developmental delays, early identification, mental health, overcoming barriers and wait lists, EIDBI. We go into very, very good detail on this and have provided recordings of all of these. Can we back up a bit, Amanda? Thanks, back to the overview. And then if you look at all these tabs along the left-hand side, we have resources provided from each of the webinars. These were provided by participants. So we're not necessarily endorsing these, but they were given by our participants as resources and tools they use in their practice. Each one of the webinars has a resource list compiled by the wisdom and referrals from our participants. So each one has this. You can click on and see all of these resources for you to use in practice. Can we go down to the bottom one, clinics provided by attendees? This also was highly requested. So we asked our attendees to share clinics where assessments for autism or developmental delays. Again, this isn't necessarily endorsed by this webinar series, but they were provided, and these are based on regions. And again, we can't promise any of these have openings, but we wanted to provide a resource that was shared. Please take a look at this. A lot of time and energy was put into it, but we wanted to provide a compilation of resources from this webinar series. And Amanda, I'd like to go back to the PowerPoint just to wrap us all up. So thank you again to everyone who attended. It has been a joy to spend these sessions with all of you. We appreciated your participation, your ideas, you being here and sharing space with us. Please watch your email. You will get a survey, and that is how you get your certificate once you complete it. We're going to ask you to provide some feedback, and who knows, we may be able to have another webinar series such as this. So we welcome the feedback, and we welcome input from you of what was helpful to you and how this changed your practice. So please take a look. Thank you again to our sponsors, Minnesota Act Early, Minnesota Department of Health Follow Along, the Minnesota Autism Resource Portal, please visit it, and the Minnesota Autism Developmental Disabilities Monitoring Network. Next slide. Thank you. And happy fall to everyone. Can't believe we started this back in March when, well, was there snow on the ground? We didn't have a very snowy winter. A little bit of snow on the ground all the way through the seasons. And now we're in our beautiful fall. Let's hope the weather stays nice all the way through November. And thank you again, all of you, for being here with all of us. Thank you to our team. And we look forward to your responses on the survey and hope to see you again soon. Thank you, everyone. Have a great day. Bye-bye.